Hey guys, it's Dr. Shelley, and you are scheduled for a LEEP procedure for your abnormal pap smear and colposcopy. So the LEEP procedure is where we actually remove the abnormal tissue on the cervix, which is precancerous. P-R-E. And so the LEEP is actually pretty interesting because it is what we call diagnostic, meaning that we get information about the actual process that's going on, and it can be curative, meaning we remove the whole area that's abnormal. So that's our goal, is to find out, that it's to confirm the colposcopy results, that it's definitely either moderate dysplasia or high grade dysplasia. Um, and then the key thing is, did we get it, are all the margins clear? So that's actually the most important part of the procedure. So when we do the LEEP procedure, I paint your cervix with something called Lugel's iodine, and that actually makes the area that is abnormal not stained. When we did the colposcopy, we actually had the areas that were abnormal were stained we used vinegar for that, and we saw the abnormal areas, and that's what we got the biopsy from. With the LEEP, like I said, it's the opposite. It's the non-staining areas that are abnormal, and that's what we aim to remove at the time of the LEEP. We remove the specimens. There are four different specimens that I will obtain. If this was your uterus, then the cervix is where we're concerned about, right? That's the opening to the uterus. So we remove the area that's abnormal at the opening to the cervix, and then we go above that area that's been removed, and we get a tissue sample from right inside, which is called the endocervix, or so that's called an endocervical curettage. Then we go up into the actual uterus itself, and we get a tissue from inside of the uterus to say that there's no issues there. So what we're doing is saying we remove the lesion, and we want to make sure that there's no precancerous changes here, and there was no precancerous or cancerous changes up above that. And then I get a culture on everybody that we do a surgery on, so we also will have that back to say that there's no infection inside of the uterus that was there before we did the procedure. Um, the um, the risk of any surgery, including this one, include the risk of infection. If you're diabetic, we will give you antibiotics, or if you have high sugars, that you will take the day of surgery and the day after. If you're not a diabetic, we do not give you antibiotics at the time of surgery, but all LEEP patients will get antibiotics to use a week from surgery inside of their vagina. The risk of bleeding. This actually is not a high bleeding procedure because we're using heat to remove the abnormal area in the cervix, and we also use a type of lidocaine that constricts the blood vessels in the cervix. So we don't lose a lot of blood with this procedure, but we have to tell you that because, once again, these are the risks that go with any procedure that you might be having done. Damage to adjacent organs. We are not trying to hurt your vagina. We're not trying to hurt your bladder, your bowel, the ureters, which connect into the cervix from the kidneys to the bladder, uh, or the actual uterus itself. We're not trying to do any damage to that or do what we call a uterine perforation. We are going in with sharp instruments, but there's an extremely small risk of putting a hole through the uterus. The key thing is to know you did it, and it doesn't really occur with a LEEP. But once again, we have to let you know because we are in that area, so you can never say never. With any surgery, there's risk of deep venous thrombosis or DVTs, which is blood clots in your legs. Now, the biggest risk of that is actually when you get taken to the hospital and get put to sleep. We're not doing any of that, so you really don't have to worry about it. But once again, we have to tell you that that's a possibility. If you had a blood clot in your leg and it broke off and went to your lungs, that's a pulmonary embolism. That is bad. We do not want that. That can actually kill you. It can definitely cause shortness of breath, chest pain, and land you in the hospital. So we don't want that to occur, but we have to tell you that that's a possibility. And with any surgery, there's a risk of death. We expect absolutely positively nothing to happen to you, but we have to tell you that. I tell patients, you take your life in your hands every time you get behind the wheel of a car. We do it several times a day, and God willing, we come out on the other end. And so there's nothing particularly dangerous about a LEEP procedure. But like I said, unfortunately, when you're reading the consent forms and when I'm telling you the risk of surgery, we have to tell you the risk of surgery, which includes all of those things. The uh, as far as one of the things I just want to remind you of is that the LEEP procedure, one of the neat things about it is that nobody's going to know you had a LEEP. The only person that would know would be another gynecologist. So it's not like you're going to actually, once everything's all healed up and stuff like that, it's not like you're going to feel any differently vaginally during sex, or during any other activity, using tampons or what have you, because you had a LEEP procedure. So rest assured that that is not an issue. Um, the day of the LEEP procedure, we have you, if your procedure's in the morning, we have you eat your breakfast before you come. If your procedure's in the afternoon, we have you eat your breakfast and your lunch before you come. It's very important that you have food on board, otherwise, you can get really nervous, and that can make you feel like you're going to pass out. And then, if you have no sugar in your system, that can really make you pass out. So, that's a double whammy. So, please eat something, even if you're not a big eater. You want to bring a throw blanket because it can be very cold in the office, and some fuzzy socks. Plan to be in the office 2 hours. The procedure itself is like about 20 minutes or less, but we have you there an hour in front, getting you ready, getting situated, getting pain medication on board, etc. All the things that we have to do to get you ready for surgery. And then the procedure itself, like I said, is about 20 minutes. And then afterwards, most people are doing great, looking like this. You get to go home. If you're looking like this, then we have you lay it off and sleep it off. We do use nitrous oxide, or laughing gas is the other name that you may have heard of, for pain relief in the majority of our patients. And it's wonderful because it just makes everything funny. We also use local numbing medicine as well. And so the great thing is, after the numbing medicine is on board, you actually don't feel anything at all, besides some pressure or something like that. And the other wonderful thing about the laughing gas is, like I said, even if you feel discomfort, it just kind of is funny, and it just goes in your system while you're doing it, but it's gone right afterwards very quickly. So you're able to drive yourself home without any issue, and you're not going to be sleepy or feeling hungover the rest of the day, which is a wonderful thing. Now, if you're a super anxious person, laughing gas is not an anxiolytic. You will not do well because you will still be very, very anxious. And so, if that's the case, we should have already discussed this, and we should have already had a plan for you to be on anxiety medicine instead. If not, please let my surgery scheduler know, and we will take care of that. And we will give you some anxiety medication to take the night before, so that you're not a nervous wreck the day of surgery. And then you will bring it with you, and that if you need to use it during the surgery, we can use it. The negative of the anxiety medication, and we certainly can do that in place of laughing gas if you, for some reason, do not want to use laughing gas, even if it's not because of anxiety. But we will use an anxiety medication along with a pain medication in place of the laughing gas. You have to have a driver, because if we give you anxiety medicine, that will make you a little loopy, and we will not let you behind the wheel of a car. So if you have to have a driver, they need to know that you're going to be in the office for 2 hours, not 20 minutes, 2 hours. They do not stay with you, so they can drop you off and go to Lowe's or go shopping, or they can go home. As long as they answer the phone, we call them back, and they come back and get you. But like I said, with the laughing gas, you don't need a driver. Anxiety medicine, you need a driver. You do not get anxiety medicine and laughing gas, just so we're clear. It's a either or. Let's see, is there anything else I forgot? Like I said, bring your fuzzy blanket, bring your fuzzy socks, eat your breakfast, eat your lunch if you're in the afternoon. Don't take any pain medication. I'm giving you pain medication when you get there. If you take your regular medications, and I think that's about it. I have another video that will go over what to expect after the surgery, so you don't have to worry about that. And there's nothing as far as medications that you need to take before the surgery. So I think we've got everything covered. And if there's any other questions that you have after you read the consent forms and you've watched this video, please let my surgery scheduler know, and either she will answer that question for you, and or she will track me down and make sure that I get you the correct answer before the surgery. If I don't talk to you sooner than the surgery, then I will see you on surgery day.